Hello, it's Dr. Rhonda Johnson. Today is Friday, October 22nd, 2021. And today I'm going to be talking about these new CDC booster recommendations. I know it's hard to understand these booster recommendations, and I want to first start off by saying please check with your PCP or your primary care health physician if you're not sure how to follow the booster recommendations. Well, yesterday the CDC approved the booster shots for Moderna and Johnson & Johnson. The FDA had previously approved them. Now, all three currently available vaccines in the United States are eligible for booster doses. And I'm going to give you the simplified version, and then I'm going to talk about unique circumstances. So here's I call it the news version. If your first dose was a COVID-19 vaccine, those are the messenger RNA vaccines. Those are Pfizer or Moderna. You're eligible for a booster 6 months after your primary series was completed. That's your primary two-dose vaccine series of Moderna or Pfizer. If you are in these following categories: 65 years and older, or 18 years and older who live in long-term care settings, age 18 years and older who have underlying medical conditions, ages 18 years and older who work or live in high-risk settings. Now, for the nearly 15 million people who got the Johnson & Johnson primary vaccine shot, you can get a booster if you are 18 and older and you were vaccinated 2 or more months ago. Now, the Pfizer and the Johnson & Johnson booster doses are the same doses as the primary vaccine dose. The Moderna booster dose is half the dose of the primary vaccine. Now, this is where it gets confusing. The CDC said you can mix and match your boosters based upon your own preference, and of course you want to talk to your doctor. Now, I know many people have already gotten their booster shots, and some are wondering, should they get the booster shot? So I want you to think about the following framework, which might be helpful to you. And this comes from a PowerPoint from the CDC, actually, in terms of their clinical guidance. Ask yourself, what are my individual risk factors for COVID-19 infection? So what is your risk of exposure, folks? Where do you live? Where do you work? Do you work in an institutional setting? And are you around a lot of unvaccinated people? And then, so that's your exposure risk. What about your risk for infection? And again, that's individual risk. How long, if you've been vaccinated, have you completed your primary series? If it's been more than 6 months ago, your immunity is not as strong as it was when you were first vaccinated. And again, think about, too, who you're around, where you live, where you work, where you play. Then think about the impact if you got COVID. What risk do you have for severe infection? Think about your underlying medical conditions. What is your health generally like? Are you in good health, fair health, bad health? What's your age? What are the risks of people that you're around? Like, are you living or caring for people who have at-risk conditions like cancer survivors or people who have, autoimmune disease? And then think about the risk if you get infected. How can you meet your obligations? Like, what happens if you get infected and you lose time off from work? Can you afford to get sick? If you're a single parent, who's going to take care of your kids? All those things should go into your factors around, do you get the booster? Then think about the potential benefits of the booster. While you reduce your risk of having severe infection, hospitalization, and dying. and then think about the potential risk of the booster. Particularly, let's say you're in that 18 to 30-year-old male group and you're worried about getting myocarditis or pericarditis, or you have a history of anaphylaxis. Again, all of these are rare, and the myocarditis, pericarditis problems after the messenger RNA vaccine are generally, they clear up over time. And then if you're a woman and you got those, the Johnson & Johnson vaccine, if you're in the ages of high risk for the female developing that blood clotting platelet disorder, it's called TTS, thrombosis with thrombocytopenia. Those are women ages 18 to 49 years. You want to talk to your doctor because you have to be concerned about getting a rare complication. Again, it's very rare, risk of thrombosis, that TTS syndrome. Again, the highest risk of women ages 18 to 49 years. If your primary dose was Johnson & Johnson, you may want to think about getting a messenger RNA vaccine to lower your risk of that complication. So again, you have to think about these things. Now remember, you have to be 18 years and up to get a booster dose for Pfizer, Moderna, and Johnson & Johnson, with one exception. Only severely immunocompromised kids who are 12 and up are eligible for a booster dose for the Pfizer vaccine. Severely immunocompromised. Those are kids with HIV, AIDS, or a primary immunodeficiency, kids who have recently had an organ transplant or been treated for cancer. Because remember, only the Pfizer vaccine has been approved for kids 12 to 15. The Moderna and Johnson & Johnson vaccines have not been approved for anybody under 18 years. Okay, so hopefully that will help you think through what you should do around the booster. Again, you got to have these conversations with your clinical care team. And I know it's tricky, but do be thinking about it because, again, we are still seeing a pandemic. We still see higher than normal rates of Delta virus transmission. You have to think about all of these things in your decision to get a booster. And I hope that will help you. And I hope that if you're eligible for a booster, you will think seriously about getting one. And I hope that if you're unvaccinated, you'll get vaccinated. As always, my views are my own, and my only intent is to help save lives. Have a blessed day.